Hello. Once again, good afternoon. This is Dr. Larry Kidd at Henry Mayo Newhall Hospital, joined by Dr. Bud Lawrence, who is Medical Director for our Emergency Department. And we're here once again on Facebook Live to provide answers to questions that you've submitted, as well as to brief you and provide some updates on what's happening here at the hospital related to COVID-19. One of the frequently asked questions is about the use of masks in terms of there seems to be a lot of attention related in the media to should people wear masks? What are the different types of masks that one might wear in order to prevent the transmission of infection or contracting COVID-19? So there are basically three classifications of masks that are frequently referred to. One is a surgical mask, the second is an N95 mask, and then what's becoming increasingly prevalent are individuals who are wearing handmade masks or masks that are not of a medical grade. So the two medical grade type of masks are the surgical mask, and primarily the surgical mask is created in order to keep things in. So for example, individuals who might be ill would wear a surgical mask to prevent secretions. Say if they cough or sneeze, the intent is to contain that so that it does not excrete to the outside and potentially others would contract the droplets from that sneeze or from that cough. The second mask is the N95 mask. It is a medical grade mask that is created in order to keep things out. So for example, healthcare professionals who are wearing an N95 mask are preventing individuals that they're taking care of. If they're doing a procedure, if that individual patient were to cough or sneeze, etc., it's to prevent those secretions from entering through that mask. So again, people who are ill generally are wearing a surgical mask. Surgical masks are created, as the name implies, originally to be worn during surgical type procedures. And again, it's to keep things inside. So when you're doing surgery, you want to keep a clean field in terms of ensuring that you don't introduce germs, so to speak, into the field, and thus preventing patients from getting infections who are now have open wounds from a surgery. The need to preserve the N95 mask is such that they are available for healthcare professionals when they need them. So if they're taking care of very ill patients, we want to make sure that there's supply of those masks for that purpose. The handmade mask is one that individuals have started to wear, in that many feel more secure in wearing those. They feel that if they were to wear the mask, that they would not contract a virus that might be out in the community that they may come in contact with. The reality is with the handmade mask is that they are not scientifically researched. We don't have a lot of data in terms of whether or not they really will be effective in that regard. But again, the CDC is reevaluating regularly the recommendations around that. So hopefully that gives you some sense of the three different types of masks, the purpose of those masks, and then the last point to make regarding the having worn a mask out into the community, for example, would be in some cases a false sense of security, because again, the primary way of preventing transmission is excellent hand washing in terms of things that you're touching in the environment, using soap and water. Hand sanitizer is the best way to prevent. Social distancing is the other key way in which you would also prevent from contracting the virus from others. So I hope that helps to clarify some points about the use of the different masks.
It's great information, Larry. Thank you. I just wanted to bring up a couple of points really to start with. The first point, we said this last time, and I think maybe there'll be more messaging that your emergency department here at Henry Mayo is here for you. We do see a decrease in volume, and it just concerns me as a physician that people might be staying home and getting sicker at home when they potentially should come in and get evaluated. Certainly, we want everyone to partake in social distancing and stay at home as much as possible. However, I do think that if you are getting sick, again, you have things like chest pain, abdominal pain, stroke-like symptoms, these types of things. I don't want you to sit at home and be too concerned to come into the emergency department. I think we're here for you, and if you come in, we will treat you and make sure that you are well. That is our purpose here in your community as your community hospital. And another piece is that a common question that comes up is that sometimes people aren't getting tested and they're being told that they could have COVID-19 and to stay home and home quarantine, or perhaps you have been tested and your test is positive. The question is sort of, how do I know when this is over? How do I know when my COVID-19 or my presumed COVID-19 infection is over? And the answer to that we've said before, but I just want to make it clear because it's becoming more and more common. You need to be 7 days from the onset of your symptoms. So your symptoms started, you went 7 days, and you have to have 3 days with no fever and improving symptoms. So if you had a cough, just that your cough is getting better, not that your cough is totally gone. So if you meet both of those criteria, which could be as early as 7 days, that would be a sign that you are theoretically, per the recommendations of the LA County Department of Public Health and CDC, through your illness, and you no longer need to be quarantined. There's no need to get any secondary negative testing.
Thank you, Dr. Lawrence. There is an inquiry regarding how patients are segregated within the hospital. Do we have a COVID unit? So first off, the vast majority of patients that are tested positive for the COVID-19 virus, they don't require hospitalization. Typically, their symptoms can be managed at home. However, should a patient's symptoms advance and they do need to be hospitalized, we have an area of the hospital dedicated for being able to manage those patients appropriately. And just as we would any other patients in the hospital, we have levels of care. So we have a basic level of medical surgical type care that's provided to patients. Then we have an intermediate level, and in some cases we have patients who are in a critical state, both COVID and non-COVID patients. And with those patients, sometimes they require mechanical ventilation, and currently a question was asked too about do we have enough vents in the hospital, that sort of thing, and currently we do. But as we've mentioned before, we're always looking ahead because we don't know when the surge might come and how many patients in the future we're going to need to take care of. So we're always researching where would we get additional supplies of ventilators, PPE, etc., should we have a major influx of patients into the hospital.
Very well put, and I have to say, as chairman of our COVID task force here at Henry Mayo, I am very confident with our preparedness thus far. I think we've done amazing work, and hopefully we'll never need any of it. That's my goal. So 2 quick questions. What about COVID-19 and ibuprofen or Motrin or Advil? And can you get the virus back after you had it once? These are quickies, so I'll just pile them together. So the COVID-19 and ibuprofen, which is the same as Motrin or Advil, there's really no definitive data on this. Much of the data is sort of perhaps based on long-term use of these medications or this medicine. At this point, there's no real answer. If you had an option to take acetaminophen or Tylenol instead of Motrin, you might want to take that. But I also don't think that you need to throw away all your ibuprofen or Motrin or Advil because we're concerned about that. And the second piece is, can you get the virus back after you had it once? It is a great question, one of many questions that we are going to know a very large amount of information about once the dust settles on this COVID-19 pandemic. Currently, it is thought that maybe there is some conferred immunity and you will only get this once. However, other coronaviruses only have immunity for maybe a year or so. So it's very hard to say what's going to actually happen with this coronavirus. I'm hopeful, though, that we will have conferred immunity. They'll be testing to look at IgG and IgM, which is kind of granular stuff to know about. But there are tests out there that we can determine who's had this and who is potentially immune. We can do titers. But anyway, back to you, Larry.
Right, thank you. And as indicated, we're learning a lot as we collect data. We have more and more people being tested. So just as the case in China, they had a large population of COVID-19 positive patients, and as a result, that analysis we've learned from, and then here in the United States, more specifically by state, by regions, etc., we're learning a lot more in which we can make decisions about treatment and so forth in the future. There's a question that came in from a grandmother indicating that she had a 7-year-old grandchild, and she wanted to know if it was okay to be with that child given that neither one of them were sick or they had symptoms. And of course, this is a difficult time in terms of families being separated in different ways because in the case of a child, for example, it appears that children often don't display symptoms or become very ill. So it is not really often known if the child is a carrier of the virus. However, we do know in older adults that they're susceptible to contracting the virus and they're more prone to becoming ill and having symptoms. So for right now, it is recommended, despite the difficulty, that older individuals really not be cohorted with younger kids at this time. Of course, that can be challenging for some families that might live together, same household, that sort of thing. But to the extent possible, you do want to try and segregate the younger from the older population.
And another real quick, this is great advice, Larry. So, Dr. Kidd, another question that came up was, does Henry Mayo receive the COVID Abbott rapid testing and result device? So this is a test that can give us a rapid result within 5 to 15 minutes. We are kind of in line to get that test. The tests themselves are federally allocated, which means that the government is basically going to tell people who can and who can get these tests and when. So we are looking at any and all testing opportunities for us to do point of care testing to increase our ability to test patients. That is on the forefront of how we manage these patients, both at home and in the hospital. Clearly in the hospital, it's critically important. So we are pushing forward on all fronts to get as much testing resources we can here at Henry Mayo, as I'm sure many hospitals are nationally.
Great. Once again, we've come to the end of our time with you on Facebook Live today. We hope that today's session has been beneficial to you. We encourage you to tune in. We will continue to update you. Our next session is scheduled for Friday at this same time. So please tune in and do take care out there.
Yep, stay healthy and put your questions in on the comment section. We'll try to get to those in the next time or perhaps next week. We thank you for tuning in, and we appreciate all you're doing in the community to stay safe and to stay home. Take care.
Good day now.